The Boston brace for scoliosis. What are the main issues and what are better alternatives? Scoliosis involves development of an unnatural sideways bending curvature which also rotates into the concavity. And scoliosis bracing has been a facet of scoliosis treatment for many decades. And typically the goal of scoliosis bracing is to stop scoliosis progression. Scoliosis is a progressive condition, meaning it's in its very nature to worsen over time. And it's almost virtually guaranteed to progress at some level over time. And the goal of scoliosis bracing really depends on the type of brace in question, but mostly the goal is just trying to slow down progression or try to stop the curve from worsening. And the goal of modern conservative braces can be very, very different. They're not limited to just slowing down progression or stopping the curve from worsening. The goal of modern corrective bracing could mean achieving corrective results. Now, corrective results means actually reducing the size of the curve on a structural level, meaning reducing the bend and the rotation to make the curve actually better than it was when you initiated the bracing. Now, when we look at different types of traditional braces, the most common type of traditional brace is something called a Boston brace. Now, a Boston brace, unfortunately, has many associated shortfalls. And the Boston brace, which was originally designed back in the 70s and really hasn't changed much in its design, despite our evolving understanding of what scoliosis is and how it progresses and other treatments that we've used to help manage and reduce scoliosis. The Boston brace doesn't really address the rotational component or the compressive component associated with scoliosis. So it's really limited to really only looking at the bend of the scoliosis. And this bend is only really addressed through something that we call a 3-point pressure system. It's not addressing the three-dimensional rotational component, or it's not addressing the compression component, because these braces are typically made so short that they can't lengthen the body at all. Boston braces are normally not customized very well, meaning they're just looking at the curvature, and most Boston braces are very similar design no matter what type of brace or curve that you present with. And I can have many patients that one with a thoracic curve or one with a lumbar curve, and they can just like swap braces as long as they're relatively the same size of body. Then that's all they're really accounting for in the different sizes, but really not really much design difference. And this 3-point pressure system, I like to use the term as that it tends to squeeze the spine into like the straighter looking position. But since it's a squeeze, it tends to weaken the spine over time. And this squeeze doesn't cause a real geometrical curve reduction on a structural level. So it creates this false sense of security because the x-ray looks okay because it's reducing the curve some, but it's not really changing the spine in a significant way to produce a corrective result. And this is one of the very big issues with Boston braces. In addition, it's because they're kind of bulky and they create sometimes a lot of squeezing, they can restrict activities and lead to kind of restrictions in breathing because of the squeezing effect. Now, there are other types of braces associated with treating scoliosis, and what I like to talk about is something called corrective bracing. Now, corrective bracing also has some different names associated with it, but when we look at corrective bracing, the goal really is to provide a corrective result. And when it comes to corrective results with a brace, the two most important things is the person that designs your brace and the person that fits your brace. Because even though a brace could have a name on the front of it, it's going to only be as effective as the person who fits it and designed it. Now, the braces that we like to use are something called ScoliBrace, and ScoliBrace is a software that allows us to design and have influence on the brace brace design, and then we also go about fitting the brace in a very aggressive or corrective manner. The goal of the ScoliBrace is not just to try to slow down the results, but it's really to augment corrective treatment results. So I would never put somebody in a brace without considering other types of treatments to help reduce and make the brace more effective. But the bottom line is the ScoliBrace represents the culmination of what we've learned in treating scoliosis and reducing scoliosis, and to address many of the shortfalls that the Boston brace tends to have. First of all, is we address all three components of the scoliosis, not just the bend, but the rotation and also the compression. And this is a very important factor, is that in order to really reduce the scoliosis, you have to unload the spine. I call it an up-down push. You have to push down on the pelvis and up in the body to lengthen the spine in a longitudinal way that just kind of squeeze it. The ScoliBrace is also fully customized, meaning that there is never two braces that are even close to being the same. No two braces look the same. Even if the patient presents with a relatively similar curve type, we're not using libraries. We're fully customizing the brace at time of scan and at time of manufacturing. So it definitely is more comfortable, it's more form-fitting, and it definitely improves compliance rates. ScoliBraces also really kind of push the spine into a corrective position, but they don't just push the spine as opposed to squeezing. The ScoliBrace actually, we designed it to actually move the body using biomechanical principles that helps unwind the spine through coupled motion to provide a straighter and a derotated spine. So it's more than just pushing, and it's definitely not squeezing. It's using biomechanical principles to get a correction. And when we combine the ScoliBrace with other types of treatment options, we can get very strong corrective results on a structural level. And some of these other treatment options, when we look at scoliosis, can be very effective in reducing a scoliosis. Now, scoliosis treatment, traditional treatment, doesn't really have any strategy when a scoliosis is mild. They pretty much do nothing. And then typically traditional bracing is commonly prescribed for moderate scoliosis, but only moderate cases that they believe are rapidly growing or they're going through puberty. If they're not rapidly growing or going through puberty, they wouldn't even recommend a brace at moderate stage. And then only when curves become severe is where they start considering spinal fusion, which is a very risky, invasive, non-functional type of treatment. So when we look at treatments in the traditional approach, there's very little to offer. Nothing for mild. Moderate cases only get braced if they're rapidly growing, and then everybody else has to wait for the curve to become severe enough to consider surgery. So when we look at other types of treatments in the conservative approach, we have many different things that we can use. And since our treatment isn't invasive, like we're putting rods and screws in somebody's spine, we can treat curves much sooner. And since we can treat curves much sooner, we can have a greater effect at stopping progression and actually reducing curves, because we know smaller curves respond better. Now, corrective bracing is definitely used in our type of conservative approach, but it's not limited to that. We also use scoliosis-specific chiropractic care, scoliosis-specific rehabilitation and office therapy. We also use scoliosis-specific types of home therapy and exercises and different types of neuromuscular education, different types of therapies and rehabilitations to improve the effectiveness of the bracing and the exercises to make it a multimodal approach. And this is where treatment truly shines. When you're combining all of these types of treatments, this is where you can not really overcome all the shortcomings associated with just give you a Boston brace and let's see what happens. And the last thing is really the management. When we look at Boston braces, typically you're given a Boston brace, here's your brace, and if your curve worsens, there's not much to do. If the curve stays the same, there's not much to do. They're not really doing anything. And the only time they make any type of changes to your brace is if you complain of the comfort or you outgrow it. Where with our treatment is that we're trying to manage the reduction. And this is one of the unique things about corrective bracing. It's very similar to orthodontistry of your teeth. You don't get braces on your teeth and come back 18 months later and your teeth are straight. Every 90 days, the orthodontist is managing how straight he can make your teeth by making modifications to your braces and doing different things to make your teeth as straight as possible. We do this exactly the same way. That no scoliosis brace on its own is enough to reduce and correct the scoliosis. But when we combine these treatments with reducing the curves and modifying the brace as we reduce the curves and modifying the brace as we reduce the curves to reduce it and to reduce it upon reduction, over this management over a period of 12 to 18 months, we can get very significant reductions, just like orthodontists can get very significant straightening in people's teeth. So traditional braces like Boston braces are very limited in their potential effect. We're very modern bracing associated with modern conservative treatment options, and then also combined with modern management of scoliosis, we can have a very significant reduction in the scoliosis. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content.